Today, we're going to be talking about gallstones, specifically what causes gallstones. Alright, so let's get started. Hello everyone, welcome. My name is Dr. Jaspreet Singh and welcome to today's video. So first, what are gallstones? Now gallstones are just hardened digestive fluid found in the gallbladder. Now the gallbladder is a pear-shaped organ which is found on the right side of your abdomen, just underneath the liver. The medical term for gallstone is cholelithiasis. It's just a fancy way of saying you have gallstones. Before we get started, let's cover some basics. What is the function of the gallbladder? Gallbladder holds digestive fluid called bile and releases it into the small intestine to help digest food. Now gallstones can range from very small sizes as small as a grain to very large sizes as big as a golf ball. Now I know what you guys are thinking. Golf ball size gallstone? Can I play golf with that? No guys, it's not ideal to play golf with the golf ball size gallstones, okay? Now there are two types of gallstones. There's cholesterol gallstones as well as pigment stones. Now cholesterol gallstones are the most common. They're usually yellow in color and they're formed from undissolved cholesterol that's left in the bile. On the other hand, the pigment stones are usually dark brown or even black, and they're usually formed from too much bilirubin. So now that we have a little bit of background about gallstones, type of gallstones, gallbladder, function of the gallbladder, let's talk about the causes of the gallstones. Now, even though it's not 100% clear what is causing the gallstones, these are some of the processes that are thought to lead to the formation of the gallstones. So let's go over some of those. Let's talk about the cholesterol gallstones. Now, normally, bile has enough chemicals in it to help dissolve the cholesterol excreted from the liver. Now, when there's too much cholesterol being excreted from the liver and the chemicals cannot dissolve the cholesterol completely, the excess cholesterol forms crystals and eventually into stones. Now, one thing I want to point out here is a lot of the patients do ask why the doctors are putting them on a low-fat diet. This is one of the biggest reasons we recommend low-fat diet for anybody suffering from gallstones. Now, the second type of gallstone, the pigment stone, happens from too much bilirubin. Now, bilirubin is a chemical that's produced by the body when the red blood cells are broken down. There are certain conditions that can cause the increase in bilirubin, like liver cirrhosis, biliary tract infections, as well as certain blood disorder like sickle cell anemia. Now, I'm not going to go in depth into any of these conditions since we're focusing on the causes of gallstones only right now. Now, this contributes to the formation of the pigment stones. Lastly, another reason for the gallstone is if the gallbladder is not functioning properly. If the gallbladder is not emptying completely or even often enough, the bile in the gallbladder concentrates and leads to formation of stones. So there you have it guys. Those are some of the reasons why you can develop gallstones. If you suspect you're having pain from gallstone pain, seek medical care right away. Because if the gallstone is stuck within the bile ducts and blocking the passage, it can lead to infection and worsening problems for you. As always guys, I appreciate you guys tuning in and watching. I will see you next time.